the practice of embodying emotions is a way to improve cognitive, emotional, and behavioral outcomes in all therapy modalities. It's a body-based practice. It's also science-based practice, and we will see the science of it. Yeah. The goal is to improve diverse outcomes and shorten overall treatment times in all therapies. Yeah. The means is embodiment of a larger range of emotions from the very first session with the client. How do we go about doing that? Yeah. First of all, we need to define what embodiment of emotion is, right? So embodiment can mean so many different things. Yeah. And so we need to define that. So let me define what is emotional embodiment. Yeah. So these are the benefits of embodying emotions for all therapies, right? So what is to expand to embody an emotion? My definition of it, and why does it lead to such good outcomes in therapies in all modalities? The definition is to expand the conscious experience of an emotion to as much of the brain and body physiology as possible. Yeah, that's what it is. So, for example, I'm anxious, or I'm sad, or even I'm terrified of dying. Yeah. The strategy is to actually expand that experience to as many places in the body as possible. Let's say it's present in the chest area, which often is the first place where people feel emotional experiences. To expand it, into the throat, into the face. To expand it into the belly, in the arms, into the legs. How much? That depends, and we'll talk about the various possibilities. But that is the idea. And when we do that, people are going to ask us the question. Many psychotherapists have asked me the question, why on earth would you do that? Because people are coming to us to resolve the grief, the pain of it. People are coming to us to resolve the fear, right? Why would you actually expand it beyond where it is in the physiology? Yeah, doesn't even make sense. These are legitimate questions. So we have to answer them first before we can motivate either the client or the therapist to engage in the practice of embodying emotions and experience firsthand what it can do for them. Yeah. Now, it turns out that when we expand the emotional experience to more places in the body, the experience of emotion like fear or guilt or shame gets more tolerable to be with. This is interesting, isn't it? It's very difficult to explain it in terms of through conventional means. I have tried to in my book, The Practice of Embodying Emotions. What it does is that in order to keep the emotional experience to a limited part of the body, the other parts of the body have to create blockages. There are all kinds of ways in which we can block experiences, right? We can constrict the body, we can not breathe, we can inhibit the nervous system. All of those things dysregulate the body, and that causes suffering. Yeah. And when we actually expand the body to expand the emotional experience, it becomes the body's dysregulation and the suffering from it is reduced. And the emotion is not too much in one place, but it's in different places. It's more tolerable. You could think about it as spreading the emotional experience in the larger container of the body. It's easier to explain from the Eastern psychological point of view. In the Eastern psychological point of view, we have the subtle body and we have the gross body. The gross body is the one that we bury in a coffin or burn at the end of its life. The subtle body, we know from a lot of research on out-of-body experiences during near-death experiences. There's a body there. Everything, all the experiences are intact enough. So Eastern psychology, the theory is that it is the subtle body that generates all life and experience in the gross body. And when we notice that an emotion is constricted one place, restricted one place, it means there's too much stimulation of energy, the entire subtle body in that place. If we were to expand the subtle body, spread it out, the stimulation is more even. Yeah. And we know from the physiology of emotions that emotions can be, especially intense ones, are felt throughout the body. Emotions are nothing more than an assessment of the impact of something on us, good or bad. And we cannot, the upper part of the body cannot be suffering from the fear of dying, and while the lower part of the body is like on vacation. It just doesn't make sense. So when we expand the experience of an emotion, especially difficult emotion, right, or unbearable excitement of having fallen in love, etc., if we can expand that experience, we can tolerate the emotion more, because the stimulation is less in every part of the body from the subtle body point of view. And from the physical body point of view, the dysregulation and stress that comes from shutting down the rest of the body to limit or even eliminate the emotional experience from the limited place that it's causing a problem, like asthma or heart palpitations, can be lessened. Yeah. So that is a strategy to expand the experience of emotion, its experience, to as much of the body as possible. How do we go about doing that? That is something that we're going to look at. What prevents it from happening? How do we do that? And that's the practice of embodying emotions. So let's go further. I just have to say that the practice of embodying emotions, that to expand the emotional experience to as much of the body as possible, is not a lifestyle prescription that you do that every moment. But hundreds of emotions we go through, some conscious, some not conscious. So it's only a clinical strategy in the face of, for example, someone who's stuck somewhere because they cannot tolerate an emotional experience. Next week, we will see, in 2 weeks, we will see a longer session where a woman who recently lost her mother could not forgive her, and let go of her. She died 2 years ago. And it's because she kept remembering a childhood incident in which she was badly wounded. It was a representative of the relationship, but she, how we remember certain events more than others. She remembered one, and we used that to go into the emotional suffering that caused, in order to expand the emotional experience throughout the body, so that she could get to a place where she could actually even have compassion for her mother and forgive her. So that can come about very quickly if we're actually willing to tackle it head on, as opposed to trying to manage it through meaning or through behavior. In fact, what we find is that when we actually expand the emotional experience throughout the body, even cognition and behavior get better. And how is that possible? Yeah, but it's not a lifestyle prescription, but a clinical strategy. Yeah. And application of the practice of embodying emotions. I've talked about clinical. We'll come back to this, how you can bring it in. But how does emotional embodiment work? We're going to look at the neuroscience of embodied cognition, emotion, behavior behind it. Yeah? And it's in the book. Yeah. And if you're, it's also available in Spanish and 12 other languages in case you happen to prefer another language. But let's look at the science behind it. Why expanding an emotional experience to more of the body is therapeutic, can be very efficient, yeah, can bring about rapid changes. So in therapy, we work with cognition, emotion, or behavior, right? Some modalities work with more of one than the other too. And the these terms, cognition, emotion, and behavior, can be elaborated more, right? So let me elaborate it. Cognition can mean anything from attention, focus, five sense perception, interpretation, yeah, and thinking, analysis, yeah, speech, language, language, the language behind the speech, imagination. All those are acts of cognition. So when I talk about cognition, I mean all of these aspects of cognition. Emotion, we're going to define emotion as anything that you refer to as affect or feeling or mood or temperament. Yeah. An emotion, of course. So it's a very broad definition of emotion, including feeling good or bad, which is a sensory motor emotion. Behavior is verbal or nonverbal behavior. Yeah. So what do cognition, emotion, and behavior have to do with the body and the environment? We have known, we have been taught for a long time that all three aspects of experience depend on the brain. The focus is so much on the brain. Yeah. What we know now from the last 25 to 30 years of research in neuroscience through the paradigm of embodied cognition, emotion, and behavior is the following. All three depend not only on the brain, but also on the body and the environment. That is what is called embodied and embedded cognition. Yeah. Now, if you think about it, it's a no-brainer in retrospect. A child's experience of bonding with its caregiver, what it thinks about it, how it perceives it, how it feels about it, how it behaves in relation to the caregiver, must depend not just on the brain. Clearly, it depends on the body through which it interacts with the caregiver and the environment. Yeah. Whether the environment is one of war or peace, whether the family system under shock from recent loss of a caregiver. Yeah. It depends on all that, right? That's so simple in retrospect. But it has taken science a long time to get to it because it has been disembodied. And now it's finding its way back. Yeah. And it's validating it. Yeah. What body psychotherapists have been saying for as long as as far back as Sigmund Freud, there's Wilhelm Reich who was saying, don't leave the body out. Don't leave the body out. The body forms defenses and it makes it hard to access emotional experience, which makes it hard to, to really grasp the situation well. Yeah. So that's what neuroscience is finding now, which is good, better late than never, right? So if that is the case, that emotion, cognition, behavior dependent on the brain, not only the brain, but the body and the environment, then any way in which the body is inhibited can come in the way of what? Cognition, emotion, and behavior, not just emotion. Make sense? Makes sense. And what we know from body psychotherapy is the following. Body psychotherapy systems is that it is often in response to unbearable or unacceptable emotional experiences, the body is inhibited in different ways. Holding the breath, constricting the muscle, inhibiting the nervous system, or even dysregulating it.